Moving on the phenyltrazine. So in phenyltrazine there is a lamotrigine drug. This is a like broad spectrum antiepileptic, and its work as like a carbamazepine and like action. So when we look to move on the like MOA of this drug. So regarding MOA, it's act on the like sodium channel. So it's prolongation of sodium channel inactivation, and also it suppress the suppression of high frequency firing, and also MOA in the is blocked up like voltage gated sensitive sodium channel. So it's blockage of voltage sensitive sodium channels. Regarding pharmacokinetics of this drug, pharmacokinetics of the lamotrigine, it is the like well absorbed orally, and its half-life is 24 hours. When you look at the adverse effect of this drug, side effect. So regarding side effect, mainly seen of sleepiness, then dizziness, diplopia, ataxia, vomiting, rashes are seen. Rashes mainly seen as like withdrawal rashes which require withdrawal. If there is a withdrawal, then there is a rashes seen. Withdrawal. And moving on regarding the now another class of drug like cyclic GABA analogs. So cyclic GABA analogs. In the cyclic GABA analog, there is a drug like gabapentin. Then there is a pregabalin. These are a drug, pregabalin. So regarding gabapentin, when you look at the MOA of the gabapentin, gabapentin enhance. It is an analog of the GABA, so it enhances GABA release, and also it modulate neuronal voltage sensitive calcium channels. And when you look at the uses of this gabapentin, so uses of gabapentin, this is like mainly used as a like adjuvant with the like other add-on drug, is as a add-on drug. adjuvant drugs or adjuvant with other antiepileptics, other epileptics, and it is a first line drug of the neurological pain. First line drug for neurological pain. So moving on the pregabalin. This pregabalin is like less prominent sedative side effect. It has less prominent less prominent sedative side effect, and it's mainly cause rashes, allergic reaction as side effect, and other mechanism of action, everything is same as the gabapentin. So moving on the newer drugs. In the newer drugs, there is some classes of drugs, some drugs like topiramate, then there is topiramate zonisamide, then levetiracetam, then there is vigabatrin, then there is tiagabin. These are drug, and also there is a lacosamide. These are drug which fall in the newer drugs. So moving on the every drug related information. So topiramates. Topiramate is a weak carbonic anhydrase inhibitor, and it is a broad spectrum anticonvulsant activity. It has broad spectrum anticonvulsant activity. When you look the MOA of this drug, MOA of topiramate, in the MOA it's there is some type of MOAs. So first there is a lot of action, so there is prolongation on sodium, prolongation of sodium channel inactivation. We initially discussed regarding how this inactivation occurs. Then there is GABA potentiation by postsynaptic effect. In this effect, it's GABA potential, it enhances the GABA action on the postsynaptic receptors. And there is antagonism of glutamate. Glutamate is an excitatory neurotransmitter. So we decrease this glutamate action on the receptor. So there is no activation or excitatory neuron action. So we need to inhibitory function. So we increase the GABA or inhibit the glutamate. So there is the inhibition of glutamate receptors. After that, there is another its cause neuronal hyperpolarization through potassium channels. Regarding pharmacokinetics of this topiramate. Regarding pharmacokinetics of topiramate, so it is radially absorbed by the orally, like good radially absorbed orally, and its half-life is of 24 hours. T-half is 24 hours. And regarding the adverse effect of this side effect of topiramate, so regarding side effect, it has impairment of attention, there is sedation, and there is ataxia as a side effect. Other side effect, like there is a patient have poor memory, then also weight loss, so it is anti-weight drug, so weight loss, and also paresthesia, and this is also caused renal stones. These are the side effects. Now moving on to another group of a drug. This is zonisamide. Regarding zonisamide, we are going to discuss regarding zonisamide. Like when we look at the MOA of this drug, it's act by prolongation of sodium. Like zonisamide act on the sodium channel or open sodium channel, so it's inactivation. So MOA is the act by the prolongation of the sodium channel inactivation. And when we look at the pharmacokinetics of this drug zonisamide, so pharmacokinetics, it is orally absorbed orally, it's given orally, and the side effect is half-life of, when we look the half-life is the more than 16 hours. So when we look at the adverse effect, side effects of this drug is dizziness, headache, irritability. So there is a dizziness, headache, irritability. There is anorexia. And there is metabolic acidosis. Metabolic acidosis also is a side effect. Acidosis. Then there is a renal stone. These are the side effects of the zonisamide. Now we are moving on the and when we look at the MOA we have already covered. So now we are moving on the another drug, levetiracetam. So regarding levetiracetam, regarding levetiracetam, like when you look at the MOA of this drug, it's modify synaptic release of glutamate and GABA. So modify the synaptic release of GABA, like increase increase release of the GABA or decrease the release of the glutamate. So there is this function. When we look at the pharmacokinetics of this drug, like when we look regarding this MOA, when we increase the GABA, it's also a suppression of neuron suppression. When we decrease the glutamate, then also it suppresses the neuron. So the function is in two types of the function, like when we increase or decrease by this modifying the synaptic release, and this is done by this levetiracetam. Now moving on the pharmacokinetics of this drug, it is completely absorbed orally, and when you look at the half-life, it is like 6 to 8. Half-life of this drug is 6 to 8 hours. And when you look at the side effects, sleepiness, then there is dizziness. After that there is a weakness in this drug. Now we are moving on the another drug, tiagabine. Regarding tiagabine, tiagabine is a newer group of drugs. So it's when we look at the MOA of this drug, how it's act, kind of action. So it's potentiates GABA and mediated neuronal inhibition by the blocking GABA transporter GAT1. Like when we look in neuronal synapse, so this is a presynaptic, this is a postsynaptic, and when we look here, there is a transporter for the when there is a release of GABA, and GABA act on the postsynaptic receptor, and after acting there is like reuptake of this drug. So reuptake of the this neurotransmitter GABA by the GAT1 receptor. When we block this, there increase the number of the GABA at the postsynaptic, so the more action of the GABA seen. This is the mechanism of action of this drug. So moving on the like pharmacokinetics of this drug. Regarding pharmacokinetics, it is well absorbed orally, and it's partially metabolized, and when we look at the excretion, it's well excreted in the feces, and regarding the T-half of this drug is like 6 hours. Regarding side effect of this drug, we can see in the side there is a mild sedation. It has mild sedation action. Then there is nervousness of the patient. Then there is amnesia. Then there is dementia, or dermatitis are the adverse effects of this drug. Now another newer drug is the vigabatrin. Regarding vigabatrin, it is approved only for the like adjuvant, approved only for adjuvant medication. medication. And when we look at the MOA of this drug, MOA of vigabatrin, so it inhibits the GABA transferase. When we discuss regarding this MOA, so this GABA is like metabolized, or like there is like it is degradation by the enzyme known as GABA transaminase. GABA transaminase. When it is degraded, so when we inhibit this drug or this enzyme, so there is no degradation, so there is an increase of the again GABA. So in this drug vigabatrin inhibit GABA transaminase enzyme, so there is increased GABA on postsynaptic and more GABA section. So when we look at the adverse effect of this side effect of this drug, so in the side effect there is a like visual field contraction, then there is alteration of color vision, then there is paresthesia seen in the as a side effect of this drug vigabatrin. So this is regarding newer drugs, and we also discussed a lot in the previous video some drugs. So the another drugs we discuss in the next video.